Thanks so much, Aaron. That was great. We're going to turn to Amy Raslovich, another cancer survivor, and she too has a really compelling story. Thank you for joining us, Amy.
Absolutely. Thank you. I'm Amy Raslovich, and I'm a breast cancer survivor, but I'm also one of 60% of Americans with at least one chronic health condition. And I apologize for stepping away from Aaron's speech. These were my healthcare bills for stage 0 cancer in the first year. And I actually have another whole bag here too. I'm grateful to be here, but if I'm going to be honest, I'm really angry. I am so tired of Congress treating us like we're stupid and powerless. I'm one of 16% of Americans who's either self-employed or runs a small business or works for one. We're the people that both parties continue to talk about as the backbone of America, the ranchers and the farmers like Aaron, the realtors, the shop owners like Victoria, the dentists, the restaurant owners. Half the people who bought insurance on the marketplace last year fall in that group. And it's actually been a success. What does the marketplace do? It guarantees that insurance that is offered actually covers pre-existing conditions, that it gives us preventive services and screenings that we need for things like cancer, essential health benefits, behavioral health care. It eliminates annual and lifetime benefits and other protections that everybody with employer-based insurance or Medicare or Medicaid are already guaranteed. Now, it's been the success, and the first Trump administration actually made it easier for brokers to help people find the right insurance. And the Biden administration came along and gave more subsidies so more people don't pay premiums. They did this after research found that nobody double dips. You're not getting insurance from an employer and one at the marketplace. Maybe one or two who forgot to cancel. But what it did is it helped younger people and healthier people actually afford insurance before they needed it, which brought premiums down for everybody. Now they want to take these subsidies away, which is going to more than double, and leave on the insurance plans the sick, which is the point of insurance is to bring everybody in, and they're kicking everybody off. So as far as these younger people, because this is another argument, younger people are less likely, they stay in the marketplace a short time, they're less likely to actually file a claim. So they're not phantoms, they just are healthy and then they go away. Now, most $0 premiums enrollees are in states like that didn't expand Medicaid, like Texas, like Florida. You take away these subsidies and double and triple people's insurances. As for fraud, because that's the big boogeyman we're going to talk about today, all this fraud, President Biden put in regulations to minimize it, and it made a big difference. President Trump's big, beautiful bill, which, all the things I think about it, one of the things they put in is to stamp out fraud, and it's going to do a good job of doing that. So where is this massive fraud they keep threatening us about? The ACA marketplace isn't a government program. Some states run exchanges to get people on and don't have fraud, like Connecticut. Other states don't regulate, like Florida. They have some fraud. But the insurance companies are private companies. United Healthcare, Aetna, Centene. They're not making money actually on marketplace. So where's the fraud? If you want to go after the fraud, do you then have to go after the private insurance? All of this, the government shutdown that Donna Marie talked about, the attack on the subsidies, is actually about one study that has already been disproven. It's already been shown by health economists that the methods are faulty and the conclusions are invalid. So this isn't a red versus blue. This isn't a D versus R. Both presidents, Biden and Trump, made changes to the marketplace because, as you said, Senator, it's not perfect, but they've made changes so that people, millions of Americans, can get insurance and that these systems become better. So what's the point of this except to steal insurance from small business owners and their employees, from the country's entrepreneurs and their farmers? Who's perpetrating these massive frauds and stealing money? Because we can't do it. Patients make nothing from it. Is it the corporations you're accusing? Is it the brokers? Then go after them. but don't steal our healthcare from us. This is what keeps us alive. It keeps us going to work. It keeps us paying our taxes and our bills, supporting our families. Don't hide behind some made up problem that doesn't actually exist. Say what you actually mean. If you want to help us, then help us. Listen to health experts, listen to actual patients and your constituents. If you need to fix something, then fix it. You don't just take it all away and leave people to get sick and die, because that's what you're doing. You don't throw the baby out with that bathwater. Be honest about your intentions. You want tax cuts for corporations, then say that. But don't do it on the backs of our health. Don't do it on the backs of our families and our communities, because that is exactly what you're doing. And then turn around and talk about the small business owners of America and Main Street America and farmers of America, because this is what we need. And you're blatantly taking it away from us. And I'm sorry that I'm angry, but I've been with Donna Marie for how long, girl, that we've been doing this, that we need the ACA to survive. We need the ACA to keep us and our families productive and healthy and together. And taking it away with some BS excuse that doesn't exist is an insult to us. It's an insult to all Americans. So I thank you for the opportunity to vent, I guess,
Thank
today.
you. That was great. Thank you so much, Amy. We're going to hear from Alejandro Lopez of San Antonio, and he too has a